I want to talk to you about sleep apnea. This is a hugely underdiagnosed condition, especially in the UK. It's estimated that around about 40% of the UK population snore, and around about 5% have sleep apnea. And a lot of people have this condition and not even realise it. So some of the things that you can look for and kind of pre-assess yourself as being at risk are whether or not you snore very loudly at night, so loud enough to be heard through a closed door, whether you're tired, fatigued and sleepy during the day, how prone are you to falling asleep, say in a car, for example, if you go on a car journey. Have you been observed to stop sleeping at night? If you have high blood pressure and your BMI is greater than 35, also if you're male, you're more likely to have sleep apnea. If you're over 50, and also if your neck circumference is greater than 40 centimetres. So sleep apnea is a potentially life-threatening condition. In sleep apnea, you have complete obstruction of your airway at night multiple times. So you're getting less oxygen to your brain, to your vital organs. And this is why 90% of nocturnal heart attacks are associated with sleep apnea. We've also found that there's a increased risk of stroke. So what can your dentist do? Well, dentists are now recognised by NICE as being able to assess for and help with treatment for sleep apnea. Now, I have undergone additional training in sleep apnea and its diagnosis and management, and I'm able to provide something called a mandibular advancement device. This is the device. It comes in two separate parts. There's a lower part and an upper part. The upper part has a hook and it locks into the lower part. This then stops the lower jaw from being able to slide backwards, which is what has that obstruction of the airway. So these are very simple to obtain. They're comfortable to wear because they're separate, and they have an 85% success rate. Now, I am able to assess your risk of sleep apnea and whether you're high risk, low risk or moderate risk. Certainly with a high risk or moderate risk, I'd be looking at referring you to your GP to look into having a referral for further sleep studies within the hospital. A CPAP machine can be incredibly helpful. For mild sleep apnea and even mild to moderate sleep apnea, these devices can be very helpful. As there's quite a waiting list for these sleep apnea studies at the hospital, it's worth having one of these for that interim time, from the time of being referred by your GP until you're able to get in for your sleep assessment. So if you think you are at risk of sleep apnea, then please get in touch and arrange for an assessment.